The transition from patient to consumer has completely revolutionized the way that we receive care. And it has led to unconventional and creative partnerships. This next panel, we're going to talk to 3 health transformers whose companies, through the emergence of both science and technology, have enabled consumers to take matters into their own hands. And that's a pretty powerful thing to do. The next companies to come on stage and health transformers are Rich Waldron, that I'd like to welcome, from Joint Academy, who is helping create healthier joints. Chris Cutter from LifeDojo, who through small behavioral changes is leading and coming up with and creating the most transformative results. And Brant Herman from MouthWatch, who is visually connecting patients to dental care. And this panel will be moderated by the one and only Shawna Butler, the most energetic, batteries included, passionate host of See You Now and nurse economist.
Thanks, Barry. I'm thinking that we need to have you stay here, actually. She's got a lot of passion. So I really want to thank Toby for setting us up to think about the social influences, the social drivers. Because when we want to reach people, we need to find where they live, work, pray, and play. And I've got 3 veterans here who are going to really help us to discuss that. But by show of hands, anecdotally, how many of you have some type of an app or some way to measure your health, your fitness, your diet, sleeping, mental health, any of those things? Okay, anecdotally, there are a lot of us who are doing it. By the numbers, ORCA, which is the Organization for the Review of Health and Care Apps, there are about close to 400,000 health apps and condition management in the health store. There are about 5 million downloads a day. Last year in 2019, there was close to $3 billion in funding in what are referred to as patient empowerment ventures. And we need to think about that in terms of empowerment, which is saying, this is what you should do, the encouragement to be able to do it, and then there's also enablement. How do we actually make that happen? So I want to start with these guys and have you guys talk in terms of moonshots. Rich, can I start with you? Like, what is your moonshot? How far are you in that? What's your team doing? What impact are you guys having?
Sure, thanks. So Joint Academy is a digital clinic working with musculoskeletal problem osteoarthritis. So I guess our moonshot would be to try and cure osteoarthritis. I saw a joint replacement doctor in the audience, and I'm sure he was excited to hear that we're going to cure joint osteoarthritis. And I think the second thing, though, that we're working on, the second moonshot, might be access to care. So if people don't get to us,
right.
and the best clinical program for managing osteoarthritis had about a 20% utilization rate, so there's 80% of the people that should be getting this care that aren't getting this care. So I think that the moonshot would be curing osteoarthritis, but the secondary moonshot might be getting people access to the program. Currently, it's a big program in Sweden. On the digital platform, we've got about 250 physical therapists working worldwide, and we've seen about 12,000 patients to date.
All right. How long have you guys been doing this? Where are you in that journey?
So it started as a clinical program in 2008. It's an orthopedic professor created probably the world's most successful musculoskeletal program, roughly translated to BOA, or Better Osteoarthritis Care. In 2014, the son of the founder, Jacob, who was supposed to be here today, digitized it. So in 2014, the program became a digital program. The National Health Service, or the single payer in Sweden, saw that as a better way of getting it out to a larger audience, and it's a more cost-effective way of delivering the program as well.
All right, moving on to the mouth. Brant, what's your moonshot? What are you guys doing?
We're under the Access to Care moonshot. I noticed some other moonshots are children and seniors, so we try to address those as well. We are aiming to connect patients and consumers to dental care in more and more settings. We want to take that traditional dental appointment and extend the reach of it so everything that's explained during an appointment is easier to understand, and it can follow you when you go home, and you can communicate with your doctor or hygienist after. And also extend the footprint of dental care into medical settings, into school settings, into nursing homes, any touch point where you have a chance to interact with a patient on a health concern. We want to use our intraoral camera.
You brought some.
I brought a little show and tell.
We love show and tell.
So just a simple USB intraoral camera that can give diagnostic quality imaging and allow a school nurse, a nurse's aide, and a senior center to share that information to a dental home and get that clinical expertise, save travel time, and ultimately when a patient needs an appointment, have all the information so they're getting the care they need.
All right, Chris, what are you guys working on? What's your team doing?
So our mission, our moonshot is to solve human behavior change, which is a pretty big
I was going to
mission.
say, that's a bold statement.
Whether it's physical health, mental health, or emotional health, the habits that we have that either optimize or de-optimize our lives in those categories, and to do that for under $100 per habit.
Per habit.
We want people to be able to change anything in their life for under $100. Where we are with that, we've had over 200,000 people go through LifeDojo as of today. And we've served employers and to a certain extent providers to date, but we are launching consumer in this quarter for the first time to reach even more people.
So that we understand the context and the nature of this problem, can you speak to oral health? What is the scale and the magnitude of what you're trying to achieve here?
One thing that surprised me when I started in this space was decay, or tooth decay, is the #1 chronic condition and chronic disease among children. There's 75% of you say you're going to the dentist every year, and 40% of you do. There's a lot of cost. It's one of the highest out-of-pocket costs. Dental insurance is definitely not like health insurance. It's more of a defined benefit package that leaves a lot of out-of-pocket costs coming in. There's a challenge with preventive care in accessing that more effectively. Medicare does not cover anything except the jaw removal for a more significant procedure instead of providing coverage for a cleaning. So what we see is really that need to expand more and more ways to address disease states earlier, turn that point of any interaction into a place where kind of oral health can be addressed a little bit earlier. Yeah, it's a huge issue that's really understated. I think in a lot of conversations about healthcare, oral health has somehow been removed from the mouth.
Yeah,
due
how
to
that
a
ever got
long
separated.
history, and I think we're starting to see medical schools say like dentists and doctors should be on the same path and then start specializing, but it's a whole different industry. I think the ADA and the cottage industry of dentistry really kept it separate, and between insurance and the business models, there is some change toward that as large DSOs, dental service organizations, have grown, like an Aspen Dental or a Pacific Dental with 1,000 locations. They have the ability to start increasing touch points, facilitating programs that expand mobile. So we've seen a consumer push instead of just access to care, which might be considered more for a vulnerable population, moving toward convenient care. So a millennial who's busy and working and doesn't want to take time, an employer who doesn't want to give you 4 hours off because they know you're cutting out early and you're going to get your cleaning and then you're done. We're seeing pop-up dental programs where they're providing preventive services on-site in a corporate campus, and then using teledentistry to have the dentist provide a treatment plan, consult with the patient, but let's get the preventive care on-site, convenient to where you are.
So it's not an understatement to say this is a massive problem. Yeah,
Yeah.
you've got a lot of work to do. Chris, particularly in the behavior space, what you guys are focusing on, there's a loneliness epidemic. We have people who are describing high rates of anxiety. There's a shortage of being able to get into mental health providers, emotional, behavioral health. What's the scale and the scope of the challenge that you guys have taken on?
Yeah, so I think most people probably know the stats, but I try to remind
Please
myself
share 'em again,
weekly,
yeah.
right? So it's one in 5 people are either anxious or depressed at any given time in America today. 1 in 3 are either obese or diabetic at any given time in America today. Less than 30% of people, when asked, report being happy, right? These are issues considering we're one of the wealthiest places on earth. And we've been working on this for a long time. Everybody has gone to Barnes & Noble and gone to the self-improvement section and tried to fix whatever they think is broken. New Year's just came and went. How many New Year's resolutions are still sticking? Right.
Well, they're here, so I was going to
You
say that
made
was
it.
one of them. Yeah.
So I think the scale of the problem is quite large. I think what's sad and sort of frightening is the speed at which it's getting worse. So
Deterioration rates.
I
Yeah.
think looking, we get the occasional Washington Post or New York Times article on like the loneliness epidemic, but it's epidemic means it's big, but it's the trajectory at which it's grown
The pace.
that we need to do something institutional, individual at every
Society.
layer. Yeah.
Mobility.
Yeah,
Pain.
it's probably more than that. It's if you look at it from an economic perspective. So if you look at the payers, whether it's a health plan or a self-insured company, musculoskeletal is usually 15% of their spend. So if you look at metabolics and you look at live births and cancers, 15% is for musculoskeletal. Of that, 50% or more, probably 60 to 65% of that is for chronic joint problems or osteoarthritis. From a numbers perspective, 30 million U.S. citizens have osteoarthritis. It costs about $185 billion a year to care for them, which is rivaling some of the other metabolic problems and congestive heart failures. And the biggest driver for that is elective joint replacements. So joint replacements are going up, I think it's 750% in the next 8 years. So it's going up about 35% per year, and that's a $30,000 to $50,000 procedure. People on our platform in about 6 weeks, half of them say they no longer consider a joint replacement an option. So that's a huge reduction in a very expensive, 1 in 400 people die during an operation for joint replacement. So that's a huge reduction in the cost and the utilization for that expensive procedure.
So you guys, the problems are huge. You've addressed the issue or the challenge of access. There's also the issue of equity. And frequently when we have ventures like yours that are very consumer facing, that are going direct to the patient, there has been resistance from the professionals. How are you guys marrying those two? I mean, it feels like you have described such a huge problem. We know we have a shortage. So how do you have that conversation to make sure that you don't have the professional resistance, you actually have the professional cooperation when you are going direct to patient, direct to consumer? I'm thinking in particular where you are going into schools and into workplaces. How is that working, Brant?
It's challenging. I think when we launched our platform 7 years ago, we were talking to private practice dentists who accepted, traditional dental insurance, and we didn't really get a lot of adoption. We saw public health programs, public health dentists, embracing our platform, kind of breaking it to make it work for how they needed to, if they had multiple settings, limited resources. So teledentistry evolved, but really the early advocates were in public health programs. What we've gone on to do is really start showing through revenue models and reimbursement strategies how a private practice or a group practice can be more efficient. That depending on your state's laws, you could have an office that's only hygienists, and your dentist, which is the most expensive part of providing dental care, can be more efficient. So they can be in one setting, and during their lunch break, they could be doing treatment plans, they could bill for the exam. Kind of explain, when you go get a dental cleaning, the dentist hops in at the end of the appointment and looks around and says, everything's good. That can be done via telehealth. So we facilitate that. We want to make sure, can the hygienist see you in any setting?
Right.
And we've definitely seen dentists who understand that hygienists generate revenue for their private practice can do that in other settings. That's easier. There's an older school of dentists who feels like, no, I don't want my hygienist to be in competition with me. Or how am I going to refer to an oral surgeon when I could be doing that case? I think that's moving away, and we've been able to get more practice to see I don't have to bill a full oral surgery suite which is a traditional dental operatory, but I could be a little bit more nimble, and I can also have a successful private practice that's integrated in the community. So I could go into a school, send my hygienist out, even send a junior dentist if my state requires that, and have this access to a whole new patient base that they're not using Yelp, they're not looking on Google, they're not finding me through a traditional marketing angle. But if I go do screenings, and we see programs thrive with this, they're going into nursing homes or senior centers or school settings, using our camera, creating a visual treatment plan that gets sent home to mom or to the adult child. Now they understand the need, right? Because doctors talk clinically, patients see a visual image, they get the image. So suddenly you're able to present it as more 60% of people. You're not competing against your hygienist. You're trying to find the 60% of people who don't come to your office. So we've been able to get really a better adoption from that.
It sounds, when you describe it, you have to stand back and wonder, why are people not rushing to make this happen? And one of the things that Startup Health is their mindset is around collaboration. I mean, it's a value that they hold. It is something that they are evangelizing. Chris, I was thinking about when you were talking about health habit changes. Who have been the unexpected collaborators? And of course, I need to ask, how are you engaging with nurses? But who are the unexpected collaborators? I mean, the social workers, school administrators. Yeah. Who are those collaborators that are making this happen?
Yeah. So I think I can start by talking about our primary target market today has been employers. And so when we launch into an employer, and I'll actually use a healthcare provider as an example, we're building layers upon layers of support teams. So you have well-being or health champions. So that's going to be, in a provider context, we've partnered with nurses, 20, 30 nurses that are sort of promoting the program in a grassroots format. And then we also have nurses as coaches. And nurses are some of the best coaches because not only do they understand the medical clinical side, but they also have that person-centered orientation, which is why our solution is so successful, is it's not prescriptive, here's what you do, it's let me get to know you, let me understand you, and then I have some ideas, but it's your program, not mine.
Right.
And nurses are quite good at understanding that, as opposed to, we've even had psychologists and psychiatrists fail at being coaches where nurses thrived. So I think that's an interesting angle. But generally, when we're in an employer context, if you don't partner with leadership, champions, and then listen to the actual people, you're not going to do very well. At first, you might get a bang, but then word spreads very quickly, either positive, negative, or neutral. And if it's not positive,
it's not going to happen.
It's not going to grow.
Yeah.
Yeah.
You've been focused, your greatest adoption has been outside of the United States. Who are the unexpected collaborators that have actually helped to make it flourish here in the States?
Well, I think we've struggled actually to get traction in the States, and I think partly because it takes so long for when I talk to a health plan or a payer, they say, why aren't the providers doing this? This sounds like it's something that should be traditional to the providers. When you talk to the providers, they say, we can't wrap our heads around this. So I think there was a research that said when something new and novel comes out, it takes 16 years for providers to adopt the new
way of practicing.
The new way of treating. And so we've struggled kind of having the providers use this as a digital ancillary referral. So we're all physical therapists on the platform. So rather than going to a clinic, the clinic comes to you via an app on your phone. So the actual workflow implementation or integration into the workflow at the provider level has been difficult. The payer seems to be more motivated. The payer understands that this is probably a better way of delivering the care, and it's more cost effective. So we've kind of partnered more with the health plans and the payer. Eventually, and this has happened in Sweden, it's now where the providers are starting to utilize the technology, having kiosks in their lobbies,
right.
And so the patient can sign up, or the medical office will sign them up for the program because they realize it's probably a better program and it's a cheaper way of delivering the program.
So each of your companies are really helping us to move upstream, to think in ways of prevention, those preclinical conversations, things that don't exist in a reimbursable type of fashion. How are you guys helping your partners, your collaborators, to see cost savings, to see revenue sources? Particularly, we've had such a hard time monetizing preventive services. How is it that in the work that you guys are doing, again, moving us up further upstream, bringing new people in, what has been the thing that's been helping you to monetize and make prevention profitable and sexy?
I think it's going to come down to, it hasn't got there yet in our contracts, but it's probably going to come down to some key outcomes. So if we claim that we reduced joint replacements by 48%, or medication use, 43% of people aren't taking medication.
How many? What was that?
43% of people are no
43%?
longer taking medication. So and we're looking into whether that's an opioid or an NSAID, and that's at 6 weeks. So I think, do we go at risk? Do we go in there and say, we'll guarantee it? And so if we don't reduce your joint replacements by 48%, then you don't owe us any money. So we haven't quite got there yet. I think we're going to get to that point where we're going to, share risk and share reward.
Yeah, I mean, one of the earlier questions was about value-based care, and this is really the crux of it.
Right.
I mean, where you're playing, Chris, there's huge cost savings potential there. How are you identifying, I mean, particularly in our mental health services, we have people who are in need, and we don't see them until it's really extreme and really, really costly. So how in your model are you actually able to help screen and have some of the preclinical conversations and divert people into the right pathways?
Yeah. So I think what's the metaphor that we like to use is there's sort of fishing, right? And then there's the wide net that you can cast into the water and pull all the fish in, and they don't even know they're caught. And that's what a stress program or a happiness program or something that feels more approachable, it's a way of getting a person from 0 to 15 miles an hour, right? There's so much stigma around mental health. There's also just the intimidation factor of like counselors and sessions, and there's got to be a copay there somewhere, and how do I do all that? And I don't want to call this number, and I don't even know if they're going to be available. In the Bay Area, you have to call 5 counselors before you find someone that even has an
Opening, yeah.
So there's all these barriers to care, and what people really need is a really easy entry point into engaging in their mental health. And so like our most popular theme is stress. Our most popular programs are deep breathing, meditation, and Make More Friends. That's our third most popular program, is Make More Friends. But through that program, you start to open up about mental health, and then our coaches are saying, hey, doing a great job with meditation. A couple weeks ago, you mentioned that you're really lonely, and that might be a symptom of depression. There's this wonderful woman at your EAP. Her name is Jane. She's available on Tuesdays. Do you want me to help you with that? And honestly, we believe everybody needs a concierge in their pocket for healthcare, because it is so intimidating. And the last metaphor I'll use, because I love metaphors, is it's like ski school, right? And I've written about this and talked about this. When someone starts skiing for the first time, I don't know if you all are skiers, you wobble out of the rental shop and you can barely hold your skis. And the last thing you want is for someone to point to the black diamond at the top and, just get on that chair and go up and fall down. You'll be fine, right? You want someone to approach you and say, let me help you put those skis on. And that's what's missing in healthcare today.
So we've been talking about what you guys are doing, and we are here at Startup Health to create action. What is not happening, and what do you guys need? How can we help you on this moonshot? You have an incredible group of people who are here. Lay it out there. What do you need, Rich?
And I think it's hard because the digital soup, or there's so many digital providers going after people. But I was talking to a health plan in New York with their provider partner, and I said, if I just discovered penicillin, would you pay for it?
Oh yeah.
And would you order it? Well, in arthritis, I did. I discovered this incredible treatment. It's cost-effective. It's patient-effective. Patients love it. If you'll pay for it and you'll order it, then we can do it. But if you don't pay for it, they're not going to order it. And if you don't order it, they don't want to pay for it. So if we could all get on the same page, if we could all get on in the same line.
So do you feel like you need consumers, citizens, to be asking for this?
Payers and providers. Now.
Payers and providers.
Yeah.
Okay.
Yep.
All right. What's your ask? What do you need to help us reach that moonshot faster?
Yeah. Well, I used to say, email me and we'll do a whiz-bang demo and I'll explain the value prop to you. And I'm sure you're all eager to do that. But I think we are actually last week for the first time announced we're going direct to consumer. So I'd actually say go to lifedojo.com/startup health and just try it yourself.
So if you need a friend,
If you need a coach in your pocket to work on that New Year's resolution, go to lifedojo.com/startup health. Because ultimately, providers and plans and employers, their value props vary so significantly when it comes to primary prevention. You tell us, but try it first because it's amazing.
Would it be helpful for you to be talking to college administrators? I mean, that is a category. Yeah.
It's great because there's finally funding for it.
Yeah.
Last year, it became a very serious initiative in the university segment. We've actually partnered with one of our partners, Sodexo, to go after that segment because they serve 1 in 3 cafeterias in America's universities. But yeah, it's a very serious issue, right? I think you were mentioning at one point, behind scenes, it's, a student is 18 years old.
They're an adult.
Yeah, they're an adult.
First time
Right.
living away from home, trying to manage a schedule. They
Yeah.
have all the opportunities to fail, and they need somebody to guide and support them. And a lot of these universities are really struggling with kids who are away from home. They're missing home, trying to figure out new routines. So I guess you want everybody to mail their alum administrator and get the dean of student services to talk to you.
Yeah.
What do you need, Brant? What can we help you with?
Got a nice wish list.
Lay it out there.
I think to a largely medical crowd, I want to see greater adoption and integration of oral health into medical care delivery to allow medical touch points to link up with dental care delivery. We want to see common sense legislation where dental practice acts and dental boards kind of evolve out of thinking hygienists need to have a dentist sitting over their shoulder, watching them do everything, treat them like nurses, allow
Scope of
them
practice.
to work in settings where a dentist isn't present, and roll over telehealth policy to include dental care providers. A lot of times we'll see states isolate dental or name specific specialties. We want to have that cover to allow kind of how procedures and services can be provided. So there's a lot, and I think just really eye-opening of allowing dentists to see their role in the bigger healthcare space and seeing medical providers finally figure out this is the touch point. This is now part of my responsibility. We talked backstage of instead of when you see a kid, don't look past their teeth down their throat, look at
Stop
their
right there.
teeth, see if there's something, and then make the referral. You don't have to do anything except make the referral.
Okay, so on that note, we're going to invite you all to smile and floss and brush every day. Thank you to you guys. I really appreciate. So let's give them a round of applause and keep on this moonshot journey.
Thank you.